Okay, after watching the physical therapist evaluation after a THA, I thought that the physical therapist um, did a great job educating the patient on the three most important hip precautions after surgery, which were not to internally rotate the hip, not to abduct past midline, and not to flex at the hip more than 90 degrees. He spoke in layman's terms and made sure the patient understood how to properly get up from sitting to standing, and then demonstrated. The strength checks that the physical therapist performed were ankle, dorsal, and plantar flexion, and knee extension, which were all appropriate for the patient's precautions and their position and long sitting. However, the physical therapist should have done so bilaterally to have something to compare it to, and therefore determine if any of those um, strength checks would have been something to address in the plan of care. Lastly, if this patient had done an open reduction internal fixation procedure, there wouldn't have been any precautions. So the transfer might have looked a little bit different. The patient would have been able to engage that postoperative leg a little bit more and probably done so a little bit more independently. However, the physical therapist may have started with some non-weight bearing exercises, range of motion, and strength. And then when it was time to transfer to standing, the patient would be able to do partial weight bearing. So instructions using the walker might have been a little bit different as opposed to the THA where the patient was able to tolerate or just put as much weight as tolerated.